Vibrant seniors, welcome back to our channel. Today, we are going to address a topic that, while sensitive, is incredibly important for all of us to understand. We're going to discuss some potential physical signs that could indicate a shift in your health and why it's crucial to be aware of these changes. This isn't about creating fear or anxiety, it's about empowering you with knowledge, because early awareness can be a significant advantage. Now, before we begin, I want to make sure that this is as clear as it can possibly be. The information presented in this video is for educational purposes only. It is not intended to be, nor should it be construed as, medical advice or a diagnosis of any kind. Experiencing any of the signs that we're about to talk about does not necessarily mean a specific health outcome is guaranteed, and it is important to remember that each of these signs can have many different causes. Our primary objective today is to simply encourage you to seek professional medical advice from a qualified medical practitioner if you notice any of these changes. Please do not make any medical decisions based solely on this video. With that very important disclaimer out of the way, if you haven't already done so, please subscribe to Vibrant Seniors to ensure you don't miss any of the valuable content that we're bringing you. And let's begin. Our first sign to discuss today is significant unexplained weight loss. This is something that should always be taken seriously, and it's about more than just losing a few pounds. It is a noticeable and unintentional decrease in your weight that can happen over weeks or even months, and it is something that you should definitely be aware of. This may be reflected by your clothing suddenly feeling much looser than before, requiring you to tighten your belt more than usual. It might also be noticed by your family, friends, or loved ones, and perhaps they may start to comment that you look noticeably thinner. This can happen gradually and over a longer period of time, or it can happen more rapidly and over a much shorter period of time, and both instances should be taken seriously. The word unintentional here is absolutely key. This isn't about you consciously trying to lose weight through any kind of deliberate diet or exercise. You might be eating normally, but you might be finding that the pounds are still coming off despite this. This is very different from that conscious effort that many people go through to lose weight. If you notice this happening and you are not trying to lose weight, it's imperative that you see your doctor as soon as possible to determine the cause. Significant unintentional weight loss can often be a symptom of many underlying medical conditions, and it can be an early indicator of something that needs medical attention. This could be due to issues with your digestive system, and perhaps your body isn't absorbing nutrients properly, or it could even be related to a metabolic issue, such as an overactive thyroid. In some cases, it may be related to more serious health conditions, such as certain types of cancers, chronic infections, or even autoimmune conditions. The possible reasons can be numerous, and this is why a medical assessment is so critical. It is important that you do not try to self-diagnose these conditions or just ignore this problem, and it is also important that you seek out the opinion of a medical professional so that you can be properly diagnosed and treated. So, when exactly should you become concerned? If you lose more than 10 pounds or 5% of your total body weight over a period of 6 to 12 months without any conscious effort, then it is absolutely time to seek medical advice as soon as you can. Your doctor will initially take a detailed medical history, asking about your diet, any recent changes in your health, and all other relevant information. They will want to know when you first started losing weight, if you have had any other symptoms, and if you have noticed any other changes in your body. They will want to understand the full picture of what you're going through. They will also carry out a physical examination, check your vital signs, and run some blood tests to assess your overall health. They may also check your thyroid function with additional tests, and also do some scans, such as X-rays or ultrasounds, to determine the root cause of the weight loss. They will consider all possible underlying causes in order to provide the most effective treatment plan, tailored to your specific needs. Please remember that this is not necessarily a sign of anything serious. Early medical assessment can be invaluable and help you to find a clear diagnosis. which will enable you to receive the treatment you need. Our next sign to discuss is persistent and increasing fatigue and weakness. This is an issue that, as we get older, many of us feel from time to time, and it is important to know when it is just a sign of getting older, and when it is a sign that something more significant may be going on with your body. Everyone feels tired at times, and this is especially true as we get older. However, the type of fatigue we are talking about today is significantly more intense and is something that you cannot simply ignore. This isn't just a case of feeling a bit sleepy after a long day or a minor lack of energy. We are talking about feeling persistently drained and weak, even if you've had plenty of rest. This can involve feeling like you lack the strength to carry out your daily activities, or finding it particularly difficult to climb the stairs, or even just walking. It's the type of fatigue that makes even the simplest tasks feel incredibly difficult. It will make your whole body feel overwhelmingly tired. You might also feel like your muscles are particularly weak, and you might struggle to lift even light objects. It's important to know that this isn't the same as just feeling tired. This is a more profound and constant feeling of exhaustion and weakness, and it is important that it is addressed. If this is describing how you're feeling, then it is absolutely critical that you get it checked out. This kind of persistent and increasing fatigue can be a sign of a number of health conditions. These can include things like anemia, heart conditions, chronic infections, or even problems with your thyroid. It could also be a sign of underlying kidney or liver problems. It is something that you should never dismiss, as it could potentially be indicating a significant underlying health issue, and it requires a proper medical evaluation. It's crucial that you seek out the opinion of a medical professional so that you can receive a correct diagnosis and then receive the best treatment plan for you. It is often tempting to ignore these feelings and just accept that this is part of the aging process, but if you feel this persistent tiredness and weakness, then it should be investigated by a professional. So, when should you become concerned? If you find that you're feeling more and more tired and weak on a regular basis, and this exhaustion doesn't improve with rest, and also if you find that the problem is just getting worse over time, then you should consult with your physician as soon as possible. Your doctor will want to fully understand the specific nature of your fatigue. They will want to learn how long you've had it, when you feel most tired, how long that tiredness lasts, and any other information that is relevant. They will likely want to assess your medical history. They will carry out a thorough physical exam, and they will likely order some blood tests to rule out the most common causes of tiredness, such as anemia or a thyroid condition. If necessary, they may also carry out further tests to determine the root cause of your fatigue. The overall goal is to identify and treat the underlying cause of this fatigue, not just the symptom of tiredness, so that you can get on the path to recovery. It is tempting to just try to push through these feelings of tiredness, but please don't ignore them. They could be a sign that your body is asking for help, and that help should be given. Our third sign is noticeable changes in bowel or bladder habits. This is a topic that may be less comfortable to discuss, but it's absolutely vital to understand what these changes might be and why they are so important. When we talk about changes in your bowel habits, we are referring to things like any sudden change in how often you go to the toilet, changes in the consistency of your stools, and also issues such as persistent and chronic diarrhea or constipation. You might also notice that your stool changes color, or that there is blood in your stool. Changes in your bladder habits might include things like needing to urinate much more often than usual, experiencing a sudden and overwhelming urge to go, or finding it difficult to completely empty your bladder. You might also be experiencing pain or discomfort when urinating, or perhaps notice blood in your urine. These are all changes that need to be taken seriously. It might also be that you're experiencing a complete loss of bladder control and leaking urine. Any of these changes should be investigated. Any noticeable and persistent changes in your bowel and bladder habits should be checked out by a medical professional as quickly as possible. These changes can often be indicators of various underlying medical issues, such as infections, digestive problems, or in some cases, more serious conditions such as bladder or bowel cancer or even kidney problems. These are not signs that you should simply ignore, and you should not try to self-diagnose the problem. You should consult a medical professional as soon as possible. If you're experiencing any of these changes, it is essential to discuss them with your doctor as soon as possible, no matter how awkward or uncomfortable that may feel. Please remember that your doctor is a professional, and they will have heard similar issues many times before. They are not there to judge you, they are there to help. So, when should you be particularly concerned? If you notice changes in your bowel or bladder habits that persist for more than a week or two, or if you see blood in your urine or your stool, then you should seek medical advice as soon as you possibly can. These symptoms do require immediate attention. Your doctor will want to know the detailed history of your symptoms. They'll also want to understand when the symptoms started, how often they occur, and if there is anything that makes them better or worse. They will carry out a thorough physical exam and may also order tests, including urine tests, stool samples, and also potentially a colonoscopy or a cystoscopy if needed, to fully evaluate your condition and correctly diagnose your problems. These tests will allow them to assess your digestive system and your urinary system. Please be as open and honest as you possibly can with your doctor about these issues. They deal with these kinds of issues every day, and they are there to help you with any problems you may have. Our fourth sign to discuss is increasing and unexplained pain. We all experience aches and pains from time to time, and especially as we get older, these can be more frequent. But it's essential to know the difference between normal aches and pains and a more serious underlying issue. The pain we are talking about today is very different to those normal aches and pains. This pain is persistent, and it doesn't seem to be related to a specific injury or incident. It is the type of pain that lingers and seems to get worse over time, and the cause isn't clear or obvious. You might experience a dull ache, or you might experience a sharp, stabbing pain, and it may be in your bones, your muscles, or even in your abdomen or chest. It's the kind of pain that won't go away with rest or over-the-counter pain medication. It's important that you pay attention to how and where you're feeling the pain, as well as how the pain makes you feel overall. This might be making you feel tired, or it might affect how well you're sleeping. If you are experiencing this type of pain, it is critical to get it checked out by your doctor. This is absolutely something that you should not try to ignore or self-treat. It is extremely important to remember that pain is a signal from your body, and this should not be ignored. Persistent and unexplained pain can have various underlying causes, including conditions such as arthritis, nerve damage, infections, or in some cases, some more serious medical conditions such as cancer or even other autoimmune conditions. It's absolutely vital that you see your doctor to get a proper diagnosis, to determine the exact cause of your pain, so that you can develop the most appropriate and effective treatment plan for your individual circumstances. It's absolutely imperative that your pain is thoroughly investigated. So, when should you become particularly concerned? If you're experiencing pain that consistently worsens over time, is not relieved by normal over-the-counter pain medication, or if it interferes with your sleep or your daily activities, then this is an absolute sign that it is time to see a physician. They will initially perform a thorough medical assessment and will want to understand where the pain is located, how intense it is, how long it lasts, and if there is anything that seems to make it better or worse. They might also order some X-rays or MRI or CT scans to help to pinpoint the exact source of the pain. Your doctor will also provide you with guidance on how to effectively manage your pain and will develop a strategy to keep you comfortable while addressing any underlying causes of that pain. Effective pain management is an important part of your care, and your doctor can help you with that. They will also guide you on how to best manage your condition long-term. Our fifth sign is skin changes or sores that don't heal. Your skin is the largest organ that you have, and it is often a great indicator of what is going on inside of your body. Changes in your skin, such as new moles that may appear quite suddenly, or existing moles that change in size, shape, or color, or sores that don't heal despite your best efforts, are all signs that you should absolutely take seriously. These skin changes might also include the sudden appearance of a rash, discoloration, or even a lump under the skin. Any of these skin changes should be taken very seriously, and you should seek out the advice of your doctor if you notice any of these issues. It is absolutely crucial that you get these changes checked by a medical professional as soon as possible, and it is vitally important that you understand why. Changes in your skin can often be an indicator of a number of issues, including skin infections, allergic reactions, or in some cases, potentially more serious problems such as skin cancer. Early detection is always the key, particularly in cases of skin cancer such as melanoma, as these conditions can be very effectively treated if detected early. This makes any early detection vital to the successful outcome of your treatment. When should you be particularly concerned? If you notice any of these changes, and especially if it involves a sore that just refuses to heal, or a mole that is changing in size, shape, or color, then please see your doctor as soon as you can. Pay particular attention to the idea of melanoma. These are absolutely key indicators that a mole might need medical attention, and it is vitally important that you know them. A stands for asymmetry, and this refers to whether or not one half of a mole matches the other half. If they don't match, then it's a cause for concern. B is for border. This refers to the border of the mole. If the border is irregular, ragged, or blurred, then this can be a cause for concern. C is for color. This refers to the color of the mole. If the color of the mole is uneven or has multiple shades, then this could be a cause for concern. D is for diameter. This refers to the size of the mole. If the mole is larger than 6 millimeters in diameter, then this could be a cause for concern. And finally, E is for evolving. This refers to whether the mole changes in size, shape, or color over a period of time. Any of these changes are an indication that this particular mole needs medical attention. Your doctor may perform a biopsy of the area, which involves taking a small sample of skin for analysis so that they can correctly diagnose the cause of the change. They will also then discuss the most appropriate treatment options for your situation. Please be proactive in the self-examination of your skin. It really can save your life. Our sixth and final sign is increasing cognitive decline or confusion. We all forget things from time to time, and this is especially true as we get older. But the kind of cognitive decline that we're talking about here today is significantly more serious and is something that you absolutely should take seriously. This can include having noticeable difficulties with your memory, or having noticeable trouble with your decision-making, or even a general feeling of confusion where you struggle to recall names or recognize familiar places, or even having difficulty with basic thinking or any sort of daily tasks. It might also include trouble following any kind of conversation, or perhaps changes in your personality. The people around you might start to notice that you are having difficulties following instructions, or that you might be repeating yourself or becoming increasingly forgetful. You might find yourself experiencing disorientation, or you may struggle to find the right words when you're speaking. Any of these cognitive difficulties should always be taken seriously. If you or your family are starting to notice these changes, it is absolutely vital to seek a professional medical evaluation as soon as you can. These signs can be indicators of a range of issues, such as dementia, Alzheimer's disease, or other conditions that can negatively affect your cognitive abilities. It is imperative to get a correct diagnosis as soon as you possibly can, as many of these conditions can be managed more effectively with early medical intervention, as well as making it easier to access the support and resources you might need for both yourself and for your family. Early diagnosis is key in managing these conditions and can have a very significant positive impact on your quality of life. It's important that you do not attempt to self-diagnose, and that you take the advice of a medical professional. So, when should you be particularly concerned? If you feel that the cognitive issues are getting noticeably worse, or if the changes are happening particularly quickly, then it is very important to get this assessed by a medical professional as soon as you possibly can. Your doctor will conduct a very thorough cognitive assessment, and this will often include some tests to evaluate your memory, your thinking abilities, and your overall cognitive function. They might also perform some brain scans, such as a CT scan or MRI, to help identify the underlying cause of the problem. It is also really important to get access to the various support groups for both patients and for their caregivers, as this can have a very significant and beneficial impact on the daily life of the patient and also for their family. Having a good support structure can also make a very significant difference for both the person who is affected by cognitive decline and also their family. These support networks can help to provide both practical and emotional support to help you to manage your condition more effectively. It is incredibly important that you can differentiate between what is normal aging and what might be a warning sign that requires a medical assessment. It is very natural for certain bodily functions to change as we get older, but it is still absolutely vital that you know the difference between the normal aging process and what might be a sign that something more significant is occurring. For example, with unexplained weight loss, it is considered normal for your metabolism to change slightly as you age. However, any kind of significant and unintentional weight loss is not at all normal and should be addressed by a medical professional. With fatigue, it's considered normal to feel tired at times, especially as we get older, but persistent and increasing fatigue, regardless of how much rest you are getting, is definitely a warning sign that should not be ignored. Similarly, minor changes in your bowel habits can happen as a normal part of aging, but any persistent issues, such as chronic diarrhea or constipation, and any changes in the color of your stool or blood in your stool are not normal, and these require immediate medical attention. With pain, the occasional ache or pain is also considered normal as we age, but any increasing and unexplained pain that doesn't subside and seems to be getting worse should absolutely never be ignored. Similarly, with changes in your skin, having a few new moles appear over your lifetime is often considered normal, but any changes in the size, shape, or color of your existing moles, or any sores that refuse to heal, need medical attention. And finally, with cognitive changes, occasional forgetting is also considered normal, but any confusion, personality changes, or memory loss that gets progressively worse should not be ignored and needs to be assessed by a medical professional. The key thing to remember here is the difference between gradual changes over a longer period of time versus any sudden changes that are not normal for you, and the speed at which these changes occur. Knowing your own body's baseline and knowing what is normal for you is absolutely key in identifying potential problems as early as possible. If something just doesn't seem or feel right to you, then you should always consult with your doctor so that they can investigate it further. So, what should you do if you notice any of these signs? The most important first step is to consult with a medical professional. Don't delay this, and don't be afraid. Many people tend to put off going to see a doctor, but early detection of any potential problem makes all the difference in a more successful treatment and positive health outcome. It is important that you address these issues as soon as possible so that any underlying causes can be diagnosed and you can receive the most appropriate treatment for your condition. The earlier a problem is diagnosed, the more effective the treatment will be and the greater your chance of recovery. When you are talking with your doctor, you should be as clear and as detailed as you possibly can. Don't leave anything out, as all the information that you have is incredibly valuable. Describe the exact symptoms that you have been experiencing, including when they first started, how often they happen, and what seems to make them worse or what makes them better. If you can keep a simple journal, logging all of these issues, then this will help you articulate your symptoms to your doctor and this will make it easier for them to understand you and then diagnose you more accurately. Don't ever hesitate to ask any questions, and make sure that you understand all your doctor's instructions and recommendations. Your understanding of your health issues is an absolutely vital component of a positive outcome. Always remember that early detection makes an enormous difference to the outcome. It gives you more treatment options and a greater chance of positive health results. It can often mean that a condition that is manageable now stays that way and doesn't progress into a more severe and harder to treat condition. It's always worth getting any potential issues checked as early as possible. And finally, it's incredibly beneficial to talk to your family and your loved ones about any symptoms that you're experiencing. They can be a great source of support for you, as well as providing another pair of eyes to monitor your well-being and provide you with extra support when needed. They may even notice symptoms that you have been unaware of. Your support network is an important component of your overall health and well-being. The main message from our discussion today is that this video is for educational purposes only and is not, under any circumstances, intended to be a diagnosis of any kind. We've discussed 6 potential physical signs that might indicate a shift in your health, but it is important to remember that these are merely potential indicators and are not, under any circumstances, a cause for alarm. It is about being aware and being proactive so that you can continue to live your best life for as long as possible. It's all about taking charge of your health so that you can stay as healthy as possible. Thank you for watching Vibrant Seniors. Your health is of extreme importance, and it is imperative that you take charge of it by knowing your own body and also addressing any issues as soon as they may appear. We sincerely hope that you have found this video to be helpful. If you have any concerns at all about the signs that we have discussed today, please consult with your doctor to get personalized medical advice as soon as you can. We wish you the very best of health, and we look forward to bringing you more valuable content in the future.